Now we welcome to the studio Dr. Christina Francis. She is the chair of the board for the American Association of Pro-Life Obstetricians and Gynecologists, also known as APLOG. Dr. Francis, welcome.
Thank you.
It's
Thank you so much for having me.
Of course. I wanted to get started by asking you, many pro-abortion advocates argue that life does not begin at the moment of conception. And I recall that during the oral arguments in the Dobbs case, Justice Sotomayor referred to the science of fetal pain as fringe science. What scientific facts can you share to refute her statement?
Absolutely. So nothing could be further from the truth. There is now overwhelming scientific evidence and really consensus within the scientific community that life, in fact, does begin at the moment of fertilization. A few years ago, there was a survey of human biologists, and what they found was that over 95% of them were in agreement that life begins at the moment of fertilization. And, you know, if we look at something like the law of biogenesis says that two humans can only produce a human being, and that little single-celled zygote at the moment of fertilization exhibits all of the characteristics of a living organism. And so, again, the science is clear. This isn't fringe science. It's well-accepted scientific fact at this point.
Yeah. Earlier, we talked to Owen Jensen. We were talking about the abortion pills, mail-in pills. Can you talk to us and explain a little bit more about the real harm that it does?
Absolutely. So chemical abortions are really kind of the next frontier for the abortion industry. They're not new. They've been around since 2000. But these are a set of two different medications that induce the death of that developing human being first, and then induce uterine contractions to expel the baby and any pregnancy-related tissues. And we know from very good scientific data, not necessarily data that's collected in the U.S., because we don't do a great job of collecting data here, but when you look at data from other countries that have done much more extensive data collection, what we see is that chemical abortions actually have a 4 times higher complication rate than surgical abortions. Things like hemorrhage and infection and even potential impact on future fertility for women. And at APLOG, we really want to get the message out not only to the medical community that they need to be on the alert for these kinds of complications, but also to women who are being lied to by the abortion industry that these are safe. They're being told that they're safer than taking penicillin or Tylenol, when in fact they have a significant complication rate, not to mention the mental trauma that women go through when their home becomes the abortion facility.
And now they're making them even more accessible.
Right, yes. So when the FDA approved Mifeprex, the abortion drug, in 2000, they put in place something called REMS, which were restrictions that limited how these medications could be administered in order to minimize the very serious adverse side effects that we know come along with it. And the FDA, unfortunately, in December, made a political decision, not a scientific-based decision, not a medical decision, but a political decision to remove what we would consider already sort of minimal medical oversight of the use of these medications. And so, like you said, now women can order them through the mail. They can use them at farther along in the pregnancy than they're approved for, when they become much more dangerous for her. And, you know, we really worry about the potential also for abuse of these medications by boyfriends who want their girlfriends to have an abortion, or sex traffickers who want their victims to have abortions. And it's already been shown that it's possible for them to obtain these medications.
Right, right. One more question. Physicians across the medical field are required to take an oath to do no harm, yet there are some doctors who perform abortions. Can this contradiction really ever be rectified, Dr. Francis?
Well, you know, you're referencing the Hippocratic Oath, which really forms the basis of medical ethics. And if you look at the original Hippocratic Oath, it expressly forbade abortion. And the reason is because it ends the life of a human being, and that's not what we're there as medical professionals to do. And so, you know, my heart really does break for my colleagues who I think legitimately think that they're helping women in doing this. But as you said, our oath is to do no harm, and abortion definitely harms the life of that preborn child. It ends their life, but it also harms the woman. And that's really the message that we want to get out there. We are pro-life, we are pro-woman, yes, and we want women to be protected from the ravages of abortion and from the lies of the abortion industry. And so the medical community needs to come back to that basic tenet of medical ethics, that we are there to protect all of our patients and that we should do no harm.
Well, and we need strong pro-life doctors like you speaking out. So thank you for your courage and for your witness. Dr. Christina Francis, thanks for being with us today.
Thank you so much for having me.